Welcome to the Baby Therapist's Crash Course, where we help you navigate the wild world of counseling and crush those board exams with confidence. Whether you're fresh out of grad school or knee-deep in client sessions, this podcast is your go-to guide for mastering the skills you need to succeed. I'm Tia Marie, your host and fellow baby therapist, here to break down complex concepts, share study tips, and get you exam ready without the stress. Let's dive in. Anger management and domestic violence risk assessment. Understanding triggers and interventions. Welcome back to the Baby Therapist's Crash Course. Today we're tackling a topic that's critical for every counselor to understand: anger management and domestic violence risk assessment. Ever wonder what's going on behind the scenes when anger spirals out of control? Or how to recognize the early signs that could lead to domestic violence? In this episode, we'll break down the strategies to manage anger and the key steps for assessing domestic violence risk before it escalates. This one's going to be intense but super informative, so stay with us. Anger. Something everyone experiences, but when left unchecked, it can lead to serious issues. In counseling, knowing how to help clients recognize and manage their anger is essential. But sometimes, anger can turn into something even more dangerous: potential domestic violence. As counselors, it's our job not only to help clients manage their emotions, but also to be vigilant about the risks of escalation. Today, we'll be diving into two critical aspects: understanding and managing anger triggers and assessing the risk of domestic violence. By the end, you'll have a solid foundation on how to approach both issues effectively in therapy. Let's get started. Part 1, understanding anger triggers and management. First up, anger management. We all know that anger is a normal emotion, but the way we respond to it makes all the difference. When clients come to therapy with anger issues, a lot of the work involves understanding what triggers their anger. Common triggers include stress, frustration, and relationship conflicts. And once we identify those, we can help clients learn to manage their responses in healthier ways. So how do we do that? Cognitive behavioral therapy, CBT, offers a powerful toolkit for anger management. One of the key techniques here is cognitive restructuring. This involves helping clients challenge irrational or exaggerated thoughts that fuel their anger. Let's say a client is upset because they believe, "She always disrespects me." That kind of all or nothing thinking can heighten their emotional response. We work with them to reframe it into something more balanced. Like, "I felt disrespected in that moment, but it doesn't mean she always disrespects me." Another effective CBT technique is conflict resolution skills. Clients need tools to manage interpersonal conflict constructively. We teach them how to communicate with "I feel" statements, where they focus on their emotions rather than blaming the other person. For example, instead of saying, "You never listen to me," they might say, "I feel unheard when you don't respond during our conversations." Pair that with active listening skills, where the client learns to really listen and understand the other person's perspective, and you've got a recipe for healthier interactions. Lastly, there are relaxation techniques to control the physiological side of anger, those racing hearts and tense muscles. Simple methods like deep breathing or progressive muscle relaxation help clients manage their body's automatic responses when anger starts to rise. For anyone studying for the NCMHCE, remember, when it comes to managing anger, CBT techniques are your go-to. The focus is on recognizing anger triggers, learning conflict resolution, and reducing physiological arousal. These skills are foundational for helping clients manage anger before it gets out of control. Part 2, domestic violence risk assessment. Now, let's shift gears and talk about something that requires immediate attention when anger escalates: domestic violence risk assessment. Here's the thing. Even if a client hasn't physically harmed someone, behaviors like yelling, throwing objects, or trying to control a partner are serious red flags. When we're assessing the risk for domestic violence, one of the key things to watch for are these escalating behaviors. Early signs could include breaking objects, yelling aggressively, or threatening language. While these actions may not seem violent yet, they signal an increase in aggression and controlling behavior that can quickly become dangerous. These are the moments where you, as the therapist, need to step in with a risk assessment. One of the tools therapists often use in these situations is the danger assessment, which helps determine the risk of domestic violence escalating. This tool looks at factors like whether there's a history of violence, access to weapons, or controlling behaviors. It's essential in guiding our next steps for safety. Even if physical harm hasn't occurred yet, don't wait for it to happen. Threatening behavior, like throwing objects or screaming, should be treated with the same level of concern. At this point, your role shifts to ensuring the safety of everyone involved. This might mean working with the client on de-escalation techniques, but in more serious cases, it might involve referring the situation for immediate intervention. When you're taking the NCMHCE, always remember that if there are signs of anger that could lead to violence, even if it hasn't happened yet, conducting a domestic violence risk assessment is the best course of action. Safety first. Overview and key takeaways. All right, let's take a quick moment to recap what we've covered today. Anger management. The goal is to identify common triggers like stress or relationship conflict and help clients manage their responses through CBT techniques. Cognitive restructuring helps clients challenge irrational thoughts that fuel their anger. Conflict resolution skills and relaxation techniques like deep breathing help manage both the emotional and physiological aspects of anger. Domestic violence risk assessment. Be on the lookout for early signs of escalation, yelling, breaking objects, or controlling behavior. Use tools like the danger assessment to gauge the risk of domestic violence, even if physical violence hasn't occurred. If you see signs of potential violence, your priority is conducting a risk assessment to ensure the safety of both partners. Whether you're dealing with anger management or the potential risk of domestic violence, the key is to stay proactive. Therapy is about helping clients not just understand their emotions, but also manage them in ways that keep everyone safe. That wraps up today's episode of the Baby Therapist's Crash Course. Remember, understanding anger management and recognizing the warning signs of domestic violence are critical skills in counseling, and they could be the difference between escalation and resolution. If you found this episode helpful, make sure to subscribe and share it with your fellow baby therapists. And don't forget, if you've got questions or topics you'd like us to cover, reach out. We're all in this together, learning step by step to be the best therapists we can be. Want to support this podcast? Show your appreciation through my Ko-fi page at ko-fi.com/thebabytherapistcc. Until next time, take care and keep those CBT skills sharp.